Hey, it's 12:30, everybody, here on a Wednesday. Dr. April Ritz in the house, and she brought toys to play with here, I think. What is this?
It's the pelvis.
Oh, okay.
You guys should be very familiar with this now. The pelvis, the bladder, the uterus, the rectum, the pelvic floor muscles, the spine.
Well, we've all had them. I've had one for almost 60 years, so I'm getting used to it.
Yes.
How about you, Brian? I don't hear him. Can I hear you now?
We haven't been there quite that long, but yeah.
Understandable. So you're here going to talk about some cool stuff today, I do believe. I saw you're going to be talking about C-sections and stuff like that. You going to talk about that?
Yeah, C-sections and any abdominal scars.
No.
Scars.
I've got 3 of them from gallbladder.
Yes.
Oh,
yeah.
Those are little ones.
Yeah, they're not
typically, hopefully.
Yeah, no, they were pretty small.
Yeah, that's good.
Brian, you got any scars yet?
Probably nothing too crazy though.
All right, very good.
I have a few. I have 2 big ones behind both of my knees from surgery from sports.
Oh yeah.
And then I have my C-section scar too.
Oh, very nice.
So
you got them covered. That's
yes.
good. All right, so we got C-section scars from a lot of people and everything. What's the deal? Can you tell us what's the deal with that?
Yeah.
Yes. So, like you said, I am with Effingham Pelvic Health and Wellness. I am a pelvic floor physical therapist, and I'm the owner there. And something we see a lot in the clinic is C-section scars and also abdominal scars. So 1/3 of births nowadays are C-sections.
Do they have to be?
No.
Okay, I was wondering about that.
Some of them are important, but the U.S. Rate of C-sections is way too high. C-sections is a major abdominal surgery, just like having like a total knee replacement, things like that.
Mm-hmm.
A C-section is a major surgery, and it's not often talked about like that. It's just like, yep, I'm just gonna have a C-section.
It's all good. No,
for some people they can go great and well, but then other people have some complications.
And that's not good.
Correct. So what I wanted to talk about with C-sections is this upcoming Sunday is National C-section Day.
They have a day for that, huh?
Wow.
They have a day for everything.
Okay. All right.
But I wanted to talk about C-section scars as well as just any abdominal scar, whether it's from like a mommy makeover surgery, a hernia surgery, intestinal surgery, anything like that. Any scars in the abdomen region can end up causing adhesions underneath to other tissue.
Oh, really?
Yes. So this is where some people will have significant pain in their scar. Sometimes it affects like the gut motility. It can cause issues there.
You say gut what?
Motility.
What is motility?
Motility
We don't use that word often.
Sorry, thank you.
Doctor.
It is.
That's like hippo birthing.
Yeah, you're like,
birthing,
how do you
all
say
these
this?
words.
Midwifery, like all the things. So it's just the movement of food through the gut. Yes. So,
gotcha.
Yeah. So if there's any adhesions from scars, it can cause pain. And actually post-op, so after surgery, intra-abdominal, and then pelvic. So adhesions in the abdomen and pelvis are leading causes of infertility, chronic pelvic pain, and intestinal obstruction. So just like we were talking about before I hopped on the show, any surgery is not, it's not just routine. Like there's no routine surgery.
No such thing as routine surgery.
I wish there was, but with surgeries, there's always risk of complications. And one of the things with having an abdominal surgery or a C-section is this risk of getting adhesions from the scar. And that's where it's really important. We highly recommend after any type of abdominal surgery or after a C-section, you come into our clinic to be seen by one of our 3 pelvic floor therapists who we treat any abdominal issue. So abdominal pain, cramping, anything like that. We are doing a lot of hands-on work. We're doing visual mobilization, which means we're working on the actual mobilizing and moving the fascia and the organs underneath the skin.
Yeah.
So this can help a lot with constipation and severe pain, period pain, things like that. So a lot of people don't realize, I'm going to use the model here real quick. So if you're watching online, you can see this, but here's like the pelvis. Men and women's pelvises are pretty similar.
Okay.
And if you have a C-section scar, it's right above this pubic bone region.
Oh, okay.
And that is so close to the bladder and as well as the intestines, including like the rectum and just the small, large intestines. So if there's any surgery through here and then that scar gets really thick and it doesn't heal properly, it can cause underlying issues. So once we see these patients after a C-section or an abdominal surgery, once this scar is healed, we are teaching them how to work on that scar to improve the mobility, reduce pain, improve sensation in that area. And of course, we're physical therapists, so we work on the muscles too. So with a C-section, the muscles themselves aren't actually cut through, but the fascia that connects to them is cut through. So those muscles are going to get weaker from abdominal surgeries and just being inactive too.
Sure.
So we're focusing on the scar, the mobility, reducing any pain, improving sensation, and also getting those core muscles to start firing again to help with, back stability and just overall support of our body.
Very interesting.
Wow, there's a lot.
There is a lot involved in that.
Yeah.
My wife, luckily we didn't have to have a C-section or anything, so that was it was good. But I know a lot of people who have, and so they may have some stuff to deal with.
Yeah, and people often are like, well, I had a C-section, 20, 30 years ago. You're going to look at that? And I'm like, we are, because I want to make sure, like, especially our patients dealing with urinary urgency issues, having to go to the bathroom very frequently, that there's a ligament that connects from the bladder up to the belly button. And so that's going to be affected. And sometimes just pulling on that scar in different directions can reproduce the urgency or the pain. And for some people, it can even lead to pain with intercourse. They're like, my abdominal tension can cause pain with intercourse. It's all related.
I'll be darned. It's all in the same area, so
that's,
there you are.
Yeah, that's our job as doctors, to figure out and put the puzzle together.
Yeah.
Figure out what we need to do.
We need doctors because we don't know any of this stuff. So I think it's a good thing we have doctors laying around here to tell us, yeah, this could happen. I'm just saying, doctors are a good thing. That's a good thing.
Yes, well, you appreciate that.
Yeah. So, so are you doing anything special for C-section day, or do you like have cake or something?
Cake. No cake. But we are doing something special. Every once in a while, we'll do some free screens in the clinic.
Oh, that's cool.
For whether it's a C-section or any type of abdominal scar, we are doing screens actually tomorrow on Thursday from noon to 1, so over lunch hour for people if they want to run in during lunch.
Yeah. Probably doesn't take long for the screen like that, right?
It's like 15 minutes.
Oh, okay.
So that's tomorrow, and then we're also doing it next Thursday from 11 to 12:30, and you can register for those. It's completely free. You can register online on our Facebook page or just call our office, and we can get you scheduled for that appointment. And then we'll just assess. So a lot of people that are coming in before we've done these are having some pain issues. So we tell them like what's going on and like what treatment will look like for them. And then the other thing, a couple other events coming up, not related to C-sections or abdominal scars, but next Saturday, the 20th in Pana, it's called the Mama Workshop.
Yeah.
And we're expecting around 11 speakers and topics. It's a 9:30 a.m. to 3 p.m. event. It's $5 to enter the door.
That's all?
That's it. $5. And it's going to cover, there's going to be so many different speakers. There are pediatric dentists. There's going to be a life coach. There's going to be a chiropractor. I'm going to be there as well. Anything for any season of motherhood, it's a great event for. And then also the following Saturday here in Effingham, so that is Saturday, January 27th, we're having our second annual Holistic Health Fair, and that is full now. So we don't have any more room for any more vendors or businesses, and that is a completely free event. We're going to have several great giveaways, fantastic speaking topics throughout the day, covering thyroid issues, Lyme disease, pelvic floor, balance issues. I think red laser, like so many different health topics.
All kinds of different things.
So both of those events can be found on our Facebook page, Effingham Pelvic Health.
And that was going to be at the First Baptist Church, right?
Yes, that is at the First Baptist Church.
Hey,
you got it.
Just to clarify, when you said it's full, do you mean the presenters are full or the attendees is full?
The presenters. Thank you for clarifying. Yes,
Anybody
can come. If you just come in anytime between 8 and 11, walk in, walk around, leave whenever you want. I will have Dr. Seberg and I are planning that event. I will have the updated schedule of like this speaking topics online soon. So people, if they're really interested, if they have thyroid issues and want to really hear the thyroid talk or whatever, they can come at those specific times.
Well, it should just come for the whole 3 hours.
They should.
They hear all kinds of it. You never know what you're going to hear may change you.
Yes, and Heartland Health Food is going to have some free food samples and several giveaways. So it's going to be fun.
Well, it sounds like a blast.
Yes. Could you squeeze any more in with all the schedule, Dr. A?
I'm sure you got some time. Sunday night, maybe.
You guys should actually come into my office. I just bought off Amazon this huge, like 6-7 foot wall calendar for the whole year.
Oh my Lord, what a big calendar!
It's up on my wall, and I have all my events. And one of my things is to not overbook myself. So no more events for the next like 3 months of the year. I have them all scheduled out for the next 3 months, and those are all online too on our Facebook page.
Okay. They're there, ready to go. Okay. Like if somebody needs to get a hold of you, like I said, you're on Facebook and your websites and stuff. You have a phone number too if somebody wants to call.
Yes, 217-705-5077.
Always a pleasure to have you here, and good luck with your busy next couple of weeks.
Thank you.
All right, Brian, let's talk to you on the drive home tonight.